here. This is very, very hands-on, so come on. Let's do 3 or 4 behind each table. So and if we need 4 or 5, looks like we got a bigger group than they told me. Yeah, don't touch anybody, don't breathe, don't cough. I'm not wearing my mask, so I hope that's okay. Okay, so I'm just going to start talking and we'll go from there. So the biggest thing I want you guys to get, I got 5 things I want you guys to get. Number 1, if I irritate you, good. If I make you think, good. If you go home and go, this guy's full of it, good. That's what I want. So the 5 things I need you guys to understand are probably what a lot of you guys are doing is completely wrong. And so we'll talk about that. But I got 25 minutes, so I got to talk fast. Questions? Shoot your hand up. I'll do my best. Let's start. Am I good to go?
Yes, sir.
We're go. Okay. Yeah, 30 minutes. Here we go. All right. Quick raise of hands. Don't be embarrassed. There's no wrong answer. When you guys have an acute injury, let's do a hamstring injury. First thing we do is, let's just say I'm going to throw. Do we ice? Show hands. Okay. Do we heat? Do we mobilize? Do we manipulate? Do we do nothing? Okay. So we got a little mix of injuries. Manual therapy, the definition is the movement passively of a joint. That's it. If you have an acute injury, the first thing we should do is actively move the joint? No. When you come to my clinic, when I work a sporting event, I will be the first person that athlete sees. I'm going to pause because we must passively move a joint, not actively engage the injured tissue. So we're clear. Passively move the joint. I have 2 physical therapists in my clinic. I'm a DC by training. I know that's a bad word. Passive movements in manual therapy are 2 things. Within the range of motion, basically within pain, out of the range of motion. That's the manipulative part. Tell your DCs and your PTs and your DOs to quit manipulating. That's coming from your DC. Give them my number and I will tell them quit manipulating. Passive movements must be done to reestablish. So, let's start out. Who has a back, pelvis, hip injury? Any one of you? Anybody hurt? Give me 4 people, 1, 2, 3, 4, 5 people that have kind of low back, pelvic stuff. Just come right down here with me. So 1, 2, 3, 4, perfect. Okay. Oh, we need you. Okay. So keep in mind, you must do a thorough history. You must do a thorough exam. We're skipping all that. A lot of my talks are done in my examination. A lot of my talks are done in some of this too. So we are assuming everything is appropriate for manual therapy. So let's do, a athlete comes in off the field. The next morning, I tweaked my hamstring. What is one thing we can do for quad injuries, hamstring injuries, groin injuries, disc problems, facet pain, pelvic dysfunction? What's one thing we can do? All right. Come on, guys. One thing. There's one thing you can do for every condition. Bingo. Joint movement. What are we here for? Passive movement. That's the first thing that needs to be done is passive movement of the joint. What's hamstring connect to? Flexion of the pelvis. Every condition you can do, you must look at the SI. I was at Lake Travis for 2 years. First 2 weeks on the job, we had 6 disc injuries. 6. First thing I did was passive movements. I won't get in all the rehab stuff. SI work. That's all I did. And then we progressed them from there. So if you have an injury to any of those body parts, you must check their SI. So we're going to learn to check the SI. We're going to work 4 muscle groups, and you're going to be masters in about 12 minutes. I'm going to give you guys a protocol that I do, whether it's a rodeo, high school setting, college setting, it doesn't matter. I will be available. I'll give you guys my cell phone number. If you have questions, if you want to set up your training room different, call me. I'll be glad to help you guys. I do lots of talks. I love helping. I want you guys to be better. Okay, so I need my hurt people line up, face this way. I want you guys to pair off. So pairs and twos, because you're going to do this right away because we have to go fast. I'm going to scoot you here. First thing you must learn is how to find the SI dysfunction. There's multiple things to do. There's lots of orthopedic tests. Step test is the quickest, fastest, easiest thing to do. So we must learn how to do step test. I'm going to kneel down, and then I'm going to put my hands, PSIS. So find your partner, thumbs, PSIS. You're going to have them raise their right knee very high and then lower it back down. Lower it. Do the left side. What you're looking for is your thumb placement. If it moves normal, your SI drops. Your thumb will drop down. If it's abnormal, your SI will roll up. So come over here, guys. And I'm just going to walk through, and then you guys are going to test on your partner, and then we're going to walk through actually people that have issues because it's easier to find. So here we go. And I can already tell you which one we have a problem. Raise your right side. See my thumb? Raise the left side. See it drop. Right, do it again. See it raise up. Drop. Do the left side. And it just rolls down. Right knee. See it raise up. See it drop. Okay, pair up. Test your partner real quick. Yeah, you guys pair up just like I said. Okay. And you guys can pair up here. Hey, Sam.
Just making a drive-by.
Yeah. So it's going to be real hard. So you're looking for your thumb movements, and we identify which side. Drop down here. Drop right here. That's your PSIS. So raise your right knee. See it raise up. Drop the left side. Okay, so we're pretty close. So let's do it again. Raise this side. Okay, so drop your hands down and then raise up. Another thing is keep your elbows tight. If your elbows turn out, your thumbs are going to change. Your elbows, you want to be moving in this motion, okay? So depending on the stability of your athlete, some athletes may have an old ACL, maybe have ankle problems, maybe their back is hurt very bad. They're going to be unstable. It does not matter. That's the great thing about this test. So I know I was here last year, there were lots of talk about SI movement placement, up, slip, down, slip. You got to find out what's not moving. Who cares? If you figure out what's not moving, now we're going to get it moving, okay? So let me grab one thing. You tie that right there. And pull the table closer if you need to. Perfect. Okay. Knee, pelvis, we have an injury. This is our muscle. If I want to help my muscle, heal, we must passively move the joint to create elasticity back in our tissue. If we keep our joint in dysfunction, I don't care what you guys do. Compact size, you can rub the muscle, you're not gonna help them. You're gonna send them out to play, and they're gonna be back, they're gonna injure it for the second time, third time, whatever. And then they're gonna be seeing surgeons, okay? So you must change the movement pattern to give your tissue a chance to heal. You work on your SI, your hamstring, your quad, your groin, your psoas, whatever, your spine can actually start healing. It's all I do 10 hours every single day. If you guys don't think this works, I'm telling you, it's what I get paid to do. You must work on your SI. So, take our muscle, it's healed, perfect. Okay, so we have understanding of which SI is not moving. Now we need to fix it. So, I need a body on the table, and let's take our hurt people. I want everybody to lay on your back. And you lay right here. And on your back, and then groups get around your people. Legs straight. So quick assessment, look for rotation of the hip, look for rotation of the feet. But remember, I gotta make this quick, we're gonna focus on SI stuff. So the biggest thing to do to figure out if the right side is not working, I wanna see which way has the SI moved. Has it moved up or back? That's it. That's all we're trying to figure out. So quick assessment, grab their feet. I'm short on the right. So if this is dropping, I know I need to lift it up. Patient here, longer on the right. So that's all you're trying to do. You figure out which side is not moving, lay him down, then you figure out which way it's not, where it's stuck, so to speak. So the number one thing I get people referred to is SI dysfunction. So practice real quick, grab ankles. Trick on this, grab their feet from behind, straighten them up, pull them together, short, long. So grab, nope, grab here.
There, okay.
Make them square, short, long. Hands here, not bad, long, short. Hands here, very off. This side short.
Now we make sure she's in line. So
hands right here. Grab them, straighten them, put them together. You have to make this square.
Can you I always put my thumbs under the medial malleolus, and you can feel that offset. That way you take the shoe out of it.
Sure, but the shoe is the quickest way because it's a flat surface. If you have a flat foot and high arched, you're getting a dysfunction. So my flat foot shoe takes all the foot problems away. It's a quicker assessment. So leave your shoes on, your athletes. Leave your shoes on. If you got a flat-footed person, high-arched person, it's gonna be all crazy. The other thing you have to worry about with your athletes is true leg length inequality. We're not getting into that. So we are assuming every person here has no leg length inequality. If you do, you just have to measure real quick, figure that out. That's also gonna create dysfunction too. It's a whole separate talk. So I can't get into a lot of things. I have to keep things pretty generalized. 4, what's my time? How much time do I have left? About 2 hours. I can talk all day. Sorry, guys. I like to talk. 4 muscle groups that I tackle. Psoas, but I don't do it very much. Quit doing the psoas. And I'm not trying to contradict one of our speakers. Do not worry about the psoas. If you think you're gonna fix low back pain with psoas, I'm gonna laugh. Quit stretching your athletes. I never stretch my athletes, ever, prior to competition, prior to working on them, ever. Quit stretching. You want them to recover and stretch in recovery? Absolutely. You'll never hear me stretch an athlete, ever. If you're gonna work out with me, we're not stretching, we're doing dynamic warm-ups. If I'm gonna devise a strength program, we're not stretching. Quit stretching, quit hurting your athletes. Passive movements, active movements, rehab, strength last. That's my protocol. I'm not worried about strengthening the muscle. You can't even lift your leg. I want you guys to go, that means I'm doing my job, okay? Don't worry about the psoas. You want to do something? Work on the iliacus. Now, sorry. Sometimes we can't touch our high school athletes. I get it. So here's my protocol. I might throw this on their low back. I might have them do self-mob, groin, hamstring. So you can do steps. You're not going to put your hands on every athlete. You can't. You have this many athletes. I can't do that. So I have stations. Half foam rollers, posterior chain stretch, complex in a group, self-mobilization another group, foam roll in another group. Then I might work on the SI. Maybe I'm just freeing the piriformis. That's it. So be selective. You got a true disc injury. I got a kid that just doesn't want to play. It's okay. We're going to treat him all the same. But we're going to prioritize who we put our hands on. And don't be afraid to say, you're doing good today. We're not going to do anything. You're not doing good. And be honest with them. You have to prioritize your people. You have to talk to your strength coaches. And you have to change their mindset because they can hurt you as much as they can help you. When I was at Lake Travis, we had to change a whole bunch of things. They thought I was crazy. Maybe I am. We were second in state my first year, and we won state the second year. We sent 30 guys to college on scholarships in 2 years. Our hamstring, quad, calf injuries, disc, facets were nearly minimal after 2 years. So, just things to think about. So don't worry about the psoas. Don't treat your patients on their back. They can't handle it. I never treat on the back. I treat on the side. I normally have pillows. So everybody turn on your left side, face the group, turn on your right side. Phones, wallets out of your pants, please. And I'm going to start with each group, and I'm going to walk through, and then you guys are going to follow right behind me. We're going to find, we're going to release, and then they're probably going to kick us out of here because we're probably running out of time. So like I said, psoas muscle, smallest, weakest of the four. Glute medius, minimus, piriformis. Psoas, iliacus. Those are the 4 or 5 that I work on. I used to do more psoas work. I hardly even touch it. I do more iliacus work just on a side note. I do a ton of piriformis. Piriformis, superior, inferior gemellus, those are your bigger muscles. Tackle those. Don't worry about your glute medius. Don't worry about your minimus, but touch them in that order. So that's the biggest thing we want to do. So let's start here. Medius, minimus. Find that. Piriformis here, sacrum. There's your piriformis. So you guys work there. Landmarks here, medius, minimus. Here, sacrum, piriformis. Come on, guys. Find your landmarks, medius, minimus. Take your fingers, go right to the sacrum, piriformis. Go ahead and start feeling. Landmarks, landmarks. So I go here, medius, minimus, here, here, piriformis. You're pretty much not going to go wrong. So go ahead and poke around there. Medius, minimus, piriformis. Go to the sacrum here. You're going to nail it. And you'll see them jump every time because they don't like it. Okay? So poke around there. Medius posterior, minimus anterior, piriformis. Right there. I can just see it. You gotta see it. You gotta see it. You gotta feel it, guys. Yes. So we find the femur, find the top of the iliac crest. There's your medius. Here's your minimus. So these are your two muscle groups right there. And then take your point, go to the sacrum, and right, you make your line.
Okay.
So your line goes here,
Okay.
piriformis.
Thank you.
And they'll go every time.
Yeah, I know.
And they'll go arch their back. Okay, so remember our demonstration here. We're only moving very minimal that SI joint. So my athlete comes in, their hamstring's pretty sore. We know it attaches here. So I'm gonna jump down to the piriformis. I have pretty big hands. The movements I like to do is I grab the front of the ASIS. I'll take my thumb, and basically what I'm doing is I'll do a couple things at once, but I'm gonna slow it down here. Usually I try to do 3 things at once because I have sometimes 8 to 10 minutes to get an athlete ready to go. So I have to do a lot of work really fast. Body mechanics are the key. I do this 10 hours a day. Done this for 20 years. I had 0 problems because I'm square. Everything is never rotated. I never internally rotate. My power comes from my shoulders, scaps, mid-back, my glutes. You'll see me rock. This is how I work. It actually comes from my toes. I don't do this. If you're doing this, you're never gonna last with me. In about an hour of working on people, you're done. Remember Val was saying they can't do they start fatiguing on hip flexion. So if I'm gonna tackle my athlete, I'm coming in just like an athlete would. I'm gonna grab, I'm gonna place, I'm gonna start poking, and then I'm going to start rotating. Poke, rotate. I'm doing 2 movements at once as I work up the piriformis. You can do the same thing for the medius and the minimus. You're just moving that. Now my rotation comes from here, and I like to push and rotate. I'm trying to get that SI to move again. They're very simple movements. Everybody makes fun of me at my sporting events because they go, this is all they see. Doesn't look like I'm doing anything. I get made fun of all the time. But then I'll say, all right, go ahead and stand up. And they'll go, oh, man, that feels great, And I got a line of people wanting the same thing. So you can do very simple movements. 30 seconds, 45 seconds. You don't have to spend a ton of time. You have to tell your athletes what you're doing. Your back is giving you trouble. We're gonna compact that. We're gonna self-mob that. Or your hamstring is giving you a problem. We're gonna release this one muscle today, and then we're gonna get some heat on this thing. We're gonna get the blood moving. I don't ever use ice. Y'all are crazy. Don't use ice on your athletes. You're making it worse. Blood heals. Just remember that. So on your side, I'm gonna walk through real quick how I do things. So I'm gonna dig, I'm gonna work, and you can tell I'm just rocking. And I'm gonna keep doing that until that movement goes. When the SI is moving, that's about all you're gonna see. And it's gonna rock just like that. When that thing is free, so that's not. So we're gonna get in here. that needs some work. And I'll grab right here, and then I just keep working up. I'm telling the body what I want. This is my pressure. Sometimes it's this, if my athlete is very sensitive. So although I'm rocking them, my pressure is still very light. It's not about more pain, more gain. It's about releasing muscles. So arching the back, we got bad stuff going on here. So first thing I would do is I'd slow it down. I'd bend the knees. And I would get smaller with my movements. And I would dig. And I would just work through that.
What's the pressure if you're...
With her, I'm going to be a little more firm because I'm not going to be doing a ton of motion. When I'm actually moving the SI, show them how much pressure I'm putting on you.
Oh, wow.
Yeah, it's not very much.
Just move and activate it.
Exactly. Exactly. And if you don't have time, throw a heat pack. Do little ancillary passive things to do. I think they're going to kick me out, guys. I know this is like, I'm trying to do a ton of stuff real quick here. Any quick questions? You guys have been really good. Any questions? Okay, so let's go back. Your athlete's hurt. You want to passively move their joint. If they hurt their knee, go to their SI. If they hurt their ankle, remember on that diagram, stand up for me, sir. Stability, mobility, 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 stability, mobility. That's what I preach. Stabilize your lumbar spine, mobilize your SI and your hips. If you stick to those principles, mobilize your thoracic spine, stabilize your cervical spine. Tell your DCs and your aggressive PTs to back off your athletes. I kid you not, the less you do, the better they're going to become. Questions?